Hi, my name is Cassandra and I'm a kinesiologist. Today I'm going to be teaching you some exercises that are intermediate in intensity for people who have knee osteoarthritis and want to get stronger. Let's get started with a warm-up. You'll need your body and a wall. We're going to begin with some calf raises. So put your hand on the wall if you need support, and we're going to start with 5 calf raises. Both legs going up onto your toes. 3, 4, and 5. You're now going to put your back up against the wall. Lean a little bit back, place your weight on your heels, and then you're going to lift both your toes at the same time. 5 as well. You're going to keep your back up against the wall, keeping your back neutral, and then with feet about hip width apart, you're going to slide down the wall in a quarter squat. So you're not going to go as far as 90-degree bend of your knee, but just a little bit, just until your toes disappear behind your knees. So if you're looking down, just about that much bend. 4 and 5. Next, we're going to be doing a hip hinge. You're still going to need the wall here. You're going to be about half a foot away from the wall, and you're going to imagine bending at the axis point right at your hips, keeping your legs fairly straight. You're going to keep a neutral spine here, and you're going to tap slightly back towards the wall. And you're going to do 5 here. 3, 4, and 5. Great. The last exercise, you're going to be doing a toe tap, just to get some weight on one leg versus the other. So, hand on the wall if you need support, and you're going to take one leg out to the side, and you're just going to tap to the side like so. 3, 4, and 5. And now you're going to do the other side. Transfer your weight. 1, 2, 3, 4, and 5. Great. Okay, now let's get started with the main portion of our exercise workout. So for this section, you're going to need your ball, a mat, the wall, and a chair. We're going to start lying down on the back. Just place the ball or pillow off to the side to begin. You're going to have your back nice and relaxed on the mat. Bring your belly button in a little bit, just so that your back stays neutral on the mat. You're going to start with your both feet up in the air, knees about 90 degrees, hips about 90 degrees. You're going to tap one heel down onto the mat at a time while you keep the other one up. Try to keep your knee in about 90 degrees the whole time that you're tapping down. You're going to do about 10 taps. So that was 4, 5, 6, keep your belly button in, 7, 8, 9, and 10. Bring both legs down to the mat, and then you're going to grab your ball or pillow. What you're going to do here is squeeze the ball in between your knees, have that nice position there, and you're also going to do a bridge at the same time. So a bridge is where you bring your belly button in, squeeze your glutes, and lift your hips so that they line with the knee and the shoulder in one long line. You're going to come up and back down. Make sure that you continue squeezing the ball or pillow in between your knees. You're going to do about 10 of these as well. Make sure that all the work stays in your glutes and hamstrings, and none is in the lower back. If you want, you can add a little bit of time at the top for a hold to increase the intensity. Once you've completed your 10 reps of the bridges, you're going to move the ball or pillow off to the side. And you're going to change so that you are now up against the wall. You're going to be lying on one side, supporting the head and neck. The bottom leg is going to be bent and your hips are just going to be slightly off of the wall. So your hips are not touching right up against. Your top leg is going to be straight and your heel is going to be pushed up against the wall. So this is better done with socks if you're at home. What you're going to do, you're going to keep your hips nice and stacked. That means not tipped forward or backwards. Keep the core engaged, and you're going to slide up the wall, creating a big arc. Okay? When you push your heel into the wall, you're going to be activating your glutes as well. Remember to check, make sure that your lower back is not arched. You'll do this for about 10 times. You'll switch to the other side. The bottom leg is going to be bent again. The top leg is straight, a little bit off of the wall. Push your heel into the wall and create a big arc. You can go as high as comfortable, so sometimes this feels good and sometimes this feels good. Do 10 of these. Once you've completed that exercise, now grab your chair. Okay, now we're going to do a sit to stand with a chair. The best is without any wheels, but if you do have an office chair like what I have here, push it up against the wall so it doesn't roll away from you when you're doing your exercises. So what you're going to do, you're going to sit right up onto the edge of the chair. You're going to tuck your heels slightly in, and you're going to think about hinging forward at your hips and then standing up. So first you're going to start hinge, get right over your quads, stand up, hinge again, and reverse. Try staying nice and tall with your chest as you do so. Now, if this is uncomfortable for your knees, you can also find a slightly higher surface to do the exercise off of. That can mean keeping the same chair and putting some pillows on top of the seat, or finding a ledge or something that is a bit higher. You're going to do about 10 of these, okay? Now, you're going to go to the wall, and you're going to do a single leg balance, okay? You're going to transfer all your body weight onto one leg, and you're just going to lift. You can have a little bit of support with the wall, or if you're feeling good, taking your hand off. Or just one finger also works. You're going to hold for about 5 seconds, and then switch legs. So again, using a full hand if you need more support, but also using just your finger or your nail against the wall to keep your balance. All right, you're going to do this for about 5 times per side, holding for 5 seconds. Great, you're all done with this portion. Okay, now let's get ready to cool down. The benefit of the cool down is to let our muscles to relax after exercise and to return our body to a normal state. So you're going to need a band like this that's a bit heavier, or a belt works as well, something firm. You're going to be starting by stretching the muscles of your calf right back here. You're going to put the band around the forefoot here, and you're going to tension the band pulling towards you, bringing your toes towards you, getting a nice stretch in the lower leg. Okay? You're going to do this for about 30 seconds. Relax your arms, and then bend your knee a little bit and do the exact same motion. So here we're stretching a slightly different muscle. Again, holding for about 30 seconds, keeping the tension there, feeling a good stretch to mild discomfort at the back of your leg. If you're finding it's painful, just release your foot, release the tension a little bit. Once you've done that on both sides, you're still going to use the belt or band, and you're going to have that help you, assist you to bend your knee back and forth. So you're going to bring your knee up towards you, using your arms to go back and forth. Now, if you do this with a sock on a smooth surface, you'll glide a little bit better than wearing shoes. You're going to do this about 10 to 15 times as comfortable before switching to the other side. Great work! You're all done with these exercises. I would recommend doing these exercises at least once daily for best results. If they're starting to get a little bit easy, just increase the reps or the depth, like bending your knee a little bit further, or it may be time to progress to the next level. Keep up the good work!